Low blood sugar, also known as hypoglycemia, can come on quickly, so it's important for the person with diabetes, their family, and friends to know how to treat it to prevent a severe reaction. It's also important to have the supplies needed to treat it with that person at all times. A low blood sugar is considered to be any reading below 70 milligrams per deciliter. Recognizing the symptoms of a low blood sugar varies from person to person, and young children in particular may not be able to tell when they're having symptoms. The body usually gives a warning that the blood sugar is getting low. It's important not only for the person with diabetes to know these warning signs and symptoms of hypoglycemia, but also their family, friends, and people who may be with them on a regular basis, such as teachers and caregivers. They also need to be able to recognize the symptoms and know how to treat it quickly. Some of the most common signs and symptoms of low blood sugar may be increased hunger, a weak or shaky feeling, irritability, appearing pale and feeling tired. Symptoms can quickly progress to having difficulty concentrating, complaining of a headache, behavior changes, drowsiness, confusion, or trouble thinking clearly. Low blood sugar can also result in loss of consciousness or a seizure. Hypoglycemia, or low blood sugar, can happen when the body doesn't have enough sugar to burn for energy. This can be caused by having too much insulin. It can occur when the dose you're currently on is too high, or you gave more than the amount prescribed, more than usual exercise or activity, not finishing a meal, eating less than 3/4 of the planned carbohydrates, or giving a shot into the muscle and not the fat. Low blood sugar can come on fast, so it should be treated right away by the person, parent, friend, or teacher. The person with diabetes or the parent of a child with diabetes should always carry a source of fast-acting sugar with them at all times. Some examples of easy-to-have fast-acting sugars are a 4-ounce juice box, 3 to 4 glucose tabs, or a small tube of cake icing or gel. Any one of those is equal to 15 grams of carbohydrate. For a mild to moderate low blood sugar, you should follow the rule of 15s. And for a severe low blood sugar, you may need to use Glucagon. The rule of 15s is the basic protocol to follow if the person's blood sugar is below 70, but they're still awake, alert, and having a mild to moderate reaction. First, you need to eat or drink 15 grams of fast-acting sugar, otherwise referred to as carbohydrate. Wait 15 minutes, and then retest your blood sugar. If your blood sugar is still less than 70, you should have another 15 grams of fast-acting sugar and wait another 15 minutes and then retest. Once your blood sugar is back over 70, you should have a 15-gram snack containing complex carbohydrate. If you had planned to have a snack or the low blood sugar occurred before a planned meal within the next hour, in that case, you do not have to have the complex carb snack. Glucagon is a hormone made in the pancreas, like insulin, but it has the opposite effect of insulin and actually raises the blood sugar level. Glucagon can be stored at room temperature but should not be exposed to extreme heat above 90 degrees or below freezing temperatures. Check Glucagon should be given if your child is non-cooperative or unable to take treatment by mouth, is unconscious, or having a seizure. A side effect of glucagon is possible nausea and vomiting, so an unconscious child should be positioned on his or her side to avoid choking. If the blood sugar is not improving within 15 to 20 minutes, a second dose can be given. Once the child is awake, he or she should be given fast-acting carbohydrate, followed by a snack of complex carbohydrate and protein. Always notify your diabetes care team of a severe low blood sugar reaction that required glucagon before the next dose of insulin is due in case a dose adjustment is needed. Here are the instructions for administering glucagon. If the child is on an insulin pump, disconnect from the pump or suspend until fully recovered and you've spoken with the diabetes care team or endocrinologist on call. Glucagon comes in a kit with a fluid-filled syringe and a vial containing a white tablet. Inject all of the fluid into the vial and the tablet will dissolve on contact. Swirl the vial to be sure it's completely dissolved. Keep the syringe in the vial and turn it over. For a person less than 45 pounds, draw out half of the solution, and if the person is over 45 pounds, draw out all of the solution. Unlike insulin, you will need to inject the solution into the muscle of the front of the upper leg or upper outer arm. You do not pinch up any skin, just inject right through the clothing and straight into the muscle. After 10 minutes, if the person is still unconscious or has difficulty breathing, has a blood sugar less than 60, or was injured due to a fall, call 911. After 10 minutes, if the person is awake, recheck the blood sugar, and if it's greater than 60, give that person sips of a fast-acting sugar, then advance to a complex carbohydrate solid food. Check the blood sugar every 15 minutes until it's greater than 80, and be sure to notify your diabetes care team about the incident.